Welcome back to North Dakota. Today we're talking about container baby syndrome with Laura Kendall, and you've got more information on this. So it's really not a syndrome.
Right. It's not a medical syndrome. It's not an illness. It's a term that we're seeing more frequently to coincide with having kids in equipment or what we might think of as infant containers more often.
Right. So we're talking things like car seat, or what do we call bumbles, bumbies?
Bumbo chairs.
Okay.
Swings, jumpers, any of those things that kids are kind of enclosed in.
Okay.
Yep.
So what are we sort of looking for here?
Sure. So frequency is a big thing.
Okay.
So really when we look at this, it's okay if they're in that equipment for short periods of time or looking at safety. You know, we have to put our kid in a car seat when we drive. That's important and that should remain. Same thing with, I've heard a lot that parents have a really hard time cooking when their kids want to be right by them, but we're by a hot stove or an oven or something where it's not safe for those kids to be right there.
And it's easy just to put them in one of these containers.
Right.
So what are some of the concerns we have with these containers?
Sure. So the biggest concerns that we're seeing is, yes, it's a lot easier to get things done when we put kids in bumbo chairs.
They're occupied.
Yep, they're occupied, they're entertained. Sometimes the standards where there's toys on, we're entertained for longer amounts of time. But then those kids aren't free to move or to gain those gross motor skills that we really want them to learn and practice at those ages.
So we're losing mobility by keeping them in these containers.
Correct, yep.
Okay.
So then we look at things like, you know, by limiting that mobility, we're looking at kicking. If we're in a car seat, you know, we might be able to kick, but not to the extent that we would if we're laying on the floor.
Not full range
Correct.
kicking, so we're getting limited motion here.
Right. Same thing if you think of a car seat, they've got kind of sides on them to protect us, right? So can we turn our head to look all the way to one side versus all the way to the other side, or is that obstructing our view? So are we limiting how often we're turning our neck? Are we causing, you know, if you don't use that, or if you don't always look all the way to your left, are you going to lose that range of motion?
Exactly.
That can turn into those head shape issues that we see. We call that plagiocephaly.
Okay.
Torticollis is when the muscle gets tight. So a lot of times those can kind of coincide together.
So you can get muscle issues in your child's neck from that.
Right. So we just want to limit the amount of time that they're in those. The other things we look at in terms of gross motor skills, if we're in a seat that's holding us there or in a swing that's holding us there, we can't learn to roll.
Right.
So we're going to see delayed rolling. If we're not rolling, we're not gaining that strength.
Yep. And parents always talk about tummy time.
Right.
So
In the 90s, you know, they started the Back to Sleep campaign, which is still great, and we still really encourage back to sleep is safest, and they've seen a decrease in SIDS based on that. But I think a lot of times we forget the second part of that back to sleep, tummy to play. So if we're really encouraging that tummy time, we like to talk to that number to be up to 60 minutes a day, whether it's a minute at a time, if that's what baby handles, or 5 minutes at a time, or 10. So kind of increasing that amount of time so we're gaining that core strength, so then we can start crawling, we can start rolling, we can start pulling to stand.
Now, as a parent who may use some of these items, which is not frowned upon by any means,
Absolutely.
What are some of the signs I can look for as a parent to know maybe this is a little bit too long in some of these containers?
Sure. You know, thinking of those gross motor milestones that we usually like to hit if you go to Well Baby Screens, or if you were to come into Red Door Pediatric Therapy, we could give you a list of babies supposed to hit this milestone by this age, this milestone by this age. So just for example, rolling. We're going to start rolling about 4 months. We're going to start independently sitting by 9 months. So if we're not hitting those milestones, then we should really be more concerned.
Okay, so if people want to contact you guys with more information, how can they do so?
They can give us a call at Red Door Pediatric Therapy, either the Bismarck or Minot locations.
Okay, so you do have 2 locations that people can contact.
Yes.
Lots of great information here. So once again, you're Laura with Red Door Pediatric, and we'll have more North Dakota Today coming up after the break.